Hi, everyone. Thanks so much for joining. My name is Nilafar Kazi, and I'm the Director of Education and Community Outreach here at the Center for Innovative GYN Care. And I'm so excited to be joined by Dr. LaNail Plummer. Hi, Dr. Plummer.
Hey, good afternoon. I'm so excited to be here with you.
Thanks for joining. So I'd like to open this conversation just by acknowledging that from the start of this year, we have all witnessed the devastating impact of COVID-19, with close to 6 million U.S. confirmed cases and over 170,000 deaths. In addition, to reduce the risk of infection to patients and physicians, much of the elective procedures performed in hospitals, including GYN-related surgeries, were put on hold up until about 4 months ago. And although hospitals are now performing elective procedures, they still have a backlog to account for. So this in turn has caused women to wait 3 to 6 months to schedule their GYN surgeries. And I think it's important to point out that although these women are waiting to have their GYN procedure done, their pain is not waiting. Their symptoms are not put on hold. Women are continuing to experience heavy bleeding, chronic pelvic pain, and an overbearing weight on the quality of their life as they wait for their turn for treatment and relief. And so they were tell you, you are this woman, you don't have to suffer alone or in silence. You can and you should seek treatment. And here to talk to us today about that is Dr. Plummer. Now, Dr. Plummer is a licensed clinical professional counselor, as well as a former patient of Dr. Natalia Danilian's here at CIGC. And she's here to share her experience on having surgery during COVID and share her journey. So, Dr. Plummer,
Yes.
could you start us off just telling us a little bit about yourself and giving us a background of your journey with your GYN condition?
Yes, absolutely. Again, I'm so excited to be here with you all. I absolutely 100% believe in talking about our life experiences when we're ready, so that we're in a position and we're able and ready to help other people. So again, I'm Dr. Plummer, and I'm the CEO of Onyx Therapy Group. And I bring that up. Well, I'll bring up a little bit about who I am so that we can talk about some of the complications in the process for me. So I'm the CEO of Onyx Therapy Group, and we're located in 3 different states. And I'm also a faculty member at Johns Hopkins University. I'm also a wife, and I am also a mother to 2 teenagers, a 13-year-old and a 16-year-old. So my life is very busy. There's never a dull moment. There's always something going on. And so when my health issues started to arise, it became extremely complicated for me because I didn't know how I was going to navigate these health experiences while also navigating my professional and personal life and all the people that were depending on me. So a little bit of background about my health condition. I come from a family of women who have a lot of women health issues. And so many families have issues with, say, hypertension or diabetes or things like that. But in our family, it was 100% the health issues. So as a young child, I was always informed about the possibilities of a hysterectomy. In fact, I was about 7 or 8 years old when my mom had her hysterectomy. And at that time, she probably was maybe 28 or 29. So she was a young woman when she had the hysterectomy. My grandmother also had a hysterectomy when she was in her 20s. And I had many aunts and cousins who also had hysterectomies. And these hysterectomies were it was a contribution from their fibroids. So they had a lot of fibroids that were growing rapidly and out of control, and resulting in them needing to have hysterectomies at 20 or in their 20s or in their 30s. So for me, I experienced some of my first pains around fibroids about 4 years ago in 2016. And my wife told me at the time, she said, I think that some of the pain that you're feeling may be connected to a fibroid. Well, because I had not had any major issues all the way through my mid-30s, it wasn't the first thought for me, although it probably should have been. Let me pause for a second there. Because I knew my family history, I also had my children very early because I knew that the possibility of having a fibroid or a series of fibroids that would lead to a hysterectomy could potentially cause me to not be able to have children. So at about 21 years old, having just graduated from Howard University, I made the decision to go ahead and have my daughter. And so I was young, but I knew that the possibilities of not having her at that age, or not having her, would increase as I got older, especially because many of my aunts and my cousins didn't have children because, like I mentioned, they had fibroids and hysterectomies in their 20s and their 30s. So let's bring it forward to 2016. I had the fibroids, and I tried to manage it the best way that I could. At the time, I did some work around that, and then they came back in 2019. The pain came back rather. And so at that point, I kind of pushed through. I didn't talk about it much. I think we're going to have an opportunity to talk about how race plays a role in some of this too. But I didn't talk about it much because I knew that once I started talking about it, I was going to have to push towards treatment, which was causing anxiety for me because I had to manage so much in my life, including the business and the students and my family, etc. However, in March, right in the middle of COVID, one of my clients told me that she was having these women health issues, and her issue ended up leading to cancer. So at that point, I said, hey, I have to take this seriously. I went in, got an appointment, and then eventually, after a second opinion, I came with you guys.
Got it. So can you tell us a little bit about, in 2016, when you started to experience intense pain, what other symptoms were you experiencing, and what did you seek any alternative ways to address those symptoms?
Yeah, absolutely. So in 2016, the pains that I was experiencing was in, of course, that area around my uterus. I later realized that it was causing additional pain, but I didn't know which organs it was affecting. It ended up affecting my bladder, and it was affecting my digestive tract as well. Mm-hmm. It caused the subsequent pains in my lower back. So that entire lower region by my belly button and underneath in the circle, including the back, was often in pain. At that time, I was going to Reiki quite often. And so I talked to my Reiki person about it. And I said, hey, I'm having these feelings around these pains. What can you do for me? She and I had already had conversations about Reiki being able to help with medical health issues as well. And so we did Reiki, and we did it for a number of months. And later, it seems that those fibroids that were there at that time shrunk. When I got the images back from Dr. D, we were able to identify which of the fibroids were the oldest. And so at that point, I realized that those fibroids probably were helped by the Reiki, but the new fibroids the Reiki wasn't going to help the new fibroids because of the size and because of the persistent pain. So I did Reiki, and I loved it, and I didn't have any pains for about 3 years after that.
That's great. So 2016, you started experiencing your symptoms. 2019, the pain came back even more intense. What happened between 2016 and 2019 where you told yourself to wait to seek treatment?
Yeah, well, after the Reiki, I wasn't experiencing the pain as much. And I think it was a combination of things with the Reiki as well. So she was treating the fibroids, but also treating the back pain. And the back pain was causing a lot of different issues. I love to work out, right? That's my additional form of therapy. And so I'm a runner, and I'm biking and things like that. And so when that pain subsided, I didn't necessarily feel the need to seek out further treatment. It was when the pain came back in 2019 that I started to become aware of the fact that maybe I was about to enter into the phase of needing to get the hysterectomy, because again, I have a family history of it. So I knew that I was going to probably have a hysterectomy. Like, the likelihood was extremely high because my mother, my grandmother, my aunts, my cousins, everyone had hysterectomies. But I prolonged it because the pain wasn't as severe. I also have a really high pain tolerance. And so that was a factor for me as well. Not anything that I would advise for people to take into consideration, right? Because when I finally went in and got my sonograms and ultrasounds, I realized that because I had waited so long, some of the fibroids had gotten so big that the only course of treatment, or the primary course of treatment, was hysterectomy. Although Dr. D explained that I had other options, if I didn't wait as long, I don't know if that fibroid would have gotten as big.
As a result of COVID, we see that healthcare delivery has shifted towards a virtual platform and very much depending on technology.
Yeah.
And although that's convenient, you you kind of lose this element of human connection and seeing your physician through a screen.
Yeah.
And I bring that up because given this shift, it's so critical for practitioners to adjust to this in terms of being sensitive to how they deliver certain information to the patient.
Yes.
Telehealth. And I'm not sure if I caught this or not because of the connection issues, but did you talk about the information that this doctor told you, that you'll be needing a full hysterectomy, that you have precancerous cells?
Yeah.
And I wanted to know, Dr. Plummer, as a mental health professional, as well as a patient, can you talk to us a little bit about the ethics of telling someone this type of information, that you need a hysterectomy or you have a likelihood of developing cancer over a telehealth appointment?
Yeah, absolutely. Excuse me. I didn't get a chance to talk about that before the connection issues, but what happened was I went to my regular PCP. She made a recommendation for me to be seen by some doctors in Annapolis, a doctor's office in Annapolis. And so when I went, my first appointment there, of course, was virtually. And then I went in for a physical appointment. And I had to go in for the physical appointment also because what I was describing to them, one of my symptoms was that my lower belly was beginning to protrude. So my uterus was now pushed out in a way that was very visible. So I could see it in my clothes and things like that. Mm-hmm. And so when I went to the clinic, we did the regular appointment and all that stuff. They did the exams. And then we had another appointment, a virtual appointment, of which they were giving me my results. Mm. And they gave me the result virtually. So they told me that indeed my uterus was under attack, is the word that I kind of used, and it had doubled in size. And then I also had a fibroid that was the size of the uterus. So that space needing to normally be about 7 centimeters, mine was about 23 centimeters of mass. So it explained the protruding. And they also informed me that I had precancerous cells on my cervix. And so this was the third time that precancerous cells had arisen in my body. And subsequently, that was their way of saying, you're going to develop cancer within the next couple of years or so, right?
Right.
And this happened virtually. So I was sitting in my office, the same place I'm in right now. My family was somewhere else in our house, and I'm getting all this news by myself, right? Because I wasn't prepared that they were going to tell me that. So I didn't have anyone in the office with me the way that we might have somebody with us when we go to the doctor's office, right? Mm-hmm. And so I was completely shocked. I, as you can tell, I have a lot of energy. I have a lot of things to say, but I couldn't say anything because one, the information was overwhelming for me. It was unexpected. I was prepared for a fibroid issue, not prepared for the sizes of these issues, not prepared for the cancer. I think the precancerous cells were the worst. But I also found it to be highly unethical for them to tell me that by video. They did not know what my circumstances were, right? And that was not a question that was asked. It probably would have been a bit more helpful if they said, hey, we have some news that we need to share. Do you have anyone at home with you or anyone you'd like to get on a call with you? What kind of support systems do you need to put in place right now? But none of that was offered to me. And so because I am a mental health therapist, I'm constantly aware of my own mental health, my own awareness, where my emotions are, where my cognitions are. But it did definitely make me think about how many other women were they delivering this type of news to virtually, and who was home by themselves, already dealing with isolation, already dealing with maybe some family issues or some relational issues, already dealing with, just being in the midst of COVID and all the implications for that. And then to tell somebody some heavy, unfortunate news like that. And it was followed by so much more too, right? It was followed by, well, and this is your issue, but we can't do the surgery for 4 to 6 months. And this is your issue, but we can't give you any medication. And this is your issue, but we really can't do anything about it. So, log off and have a great day, completely inappropriate, right? And completely unethical. And there were other elements of that became challenging too, because I was asking questions about their positions around race and how that impacts fibroids. I was asking them about age and how that impacts fibroids. And as a researcher myself, I had a lot of information already. And because this is a family issue for me, I had a lot of information already. However, I wanted to hear what the surgeon's position was on this, right? Like, if you are going to be removing something from my body, if you're removing my uterus, removing the womb that carry my children, let's have a conversation, right? Like, is it for her? It was probably just a normal, regular procedure, right? Multiple hysterectomies that are done. But for me, this was my life. And so what I also found with that particular clinic is that I felt like I was a part of a factory line. You know, here's LaNail Plummer, another person with a fibroid, another person with cervical issues, another person with uterus issues. Let's get her in, let's do the surgery, let's get her out. And that's not okay. Like, I'm a mother and I'm a wife, and I have obligations, and I'm a Black woman, and my people have had a history of bad healthcare issues, right? Like, being experimented on. And so I wanted to have a conversation about the person who was going to be, you know, removing something from my body. And she just wasn't either open or equipped to it. And so that became a major issue for me. I think that was probably one of the bigger issues. The complications around waiting 4 to 6 months and not having the medication, those were concerning. But the fact that the doctor was not engaging with me, and she was about to, you know, she wanted to do this surgery, was the hardest part for me to deal with. And subsequently, I made the decision not to deal with them, right? And that's how I came to Dr. D. But completely unethical and irresponsible, and no concern for who I was as a person in delivering that news, right? Like, we are dealing with a lot of folks that are experiencing death by suicide and are having addictive behaviors. And she didn't know if I would spiral or anything. It was not even a question. It was not even a concern. It was, well, let's just deliver this information for you or to you.
Right. Absolutely. Thank you so much for sharing that. And I'm so sorry you had to experience that virtually.
Yeah.
Now, in the beginning of this talk, you wanted to further talk about the cultural implications,
yes,
and the racial disparities that you experienced. And so
yes,
can you shed some light on that?
Yes. I come from, clearly, I'm a Black woman, and I've been educated a lot around the experiences that Black people have experienced with healthcare, right? You know, we're talking about the Tuskegee experiments, right? Or Henrietta Leaks up at Johns Hopkins in Baltimore, and cancer cells and things like that, right? And there's so much more, so many more experiments that have been done on Black people, and especially Black women. And then also the consideration around the fact that our research is showing us that it's mostly Black and brown women who are experiencing fibroids at the highest rates, right? And then it coming from my family line, I had lots of questions around how the healthcare industry was going to respond to me. As a healthcare provider myself, a mental health care provider, I'm very conscious about how culture plays a role into one's entry into healthcare and their sustainability as a client. How do they enter into healthcare? How do they sustain themselves in healthcare? How do they exit if they need to exit? And so for me, I think that there needs to be extra consideration when we're looking at minority groups when it comes to healthcare. If we're talking about fibroids and I'm a Black woman, the doctor, the surgeon, and I need to talk about what that means for me as a Black woman, right? And there weren't even many conversations around whether I was done having children, whether I wanted any more children, and what my experiences were. There were no conversations about that. I had questions related to, you know, if birth control was a contributing factor, or if exercise was a contributing factor, or diet was a contributing factor, because a lot of those elements can be based in culture too, right? Like the foods that we eat, or the medication, the herbs that we take part in, and things like that. Like, are those things contributing to this healthcare issue for me? And how could I subsequently prevent my daughter from having to go through some of the same things? This particular doctor, and she was not a Black woman, but she did not engage at all around these conversations. You know, when asked about her thoughts around Black women and fibroids, she was just like, yes, you guys have a lot of fibroids.
Wow.
Well, of course I know that. I want to know more about your position on it. I want to know more about your thoughts about it. You know, you've been a medical doctor for a number of years and you've done your own research. Like, talk to me about this, right? I wonder if to some degree also how class played a role in it. I think I mentioned before that there, at one of my doctor's appointments, I was dressed down, right? I was just very casually with maybe some shorts and some jeans and some sneakers on or something like that. And I recognized that when I was asking these questions, what registered in her face was that she was surprised that I was even asking the questions. Maybe thinking that I was not researched on it, or maybe thinking that because of my presentation, I wouldn't speak the way that I did, or whatever the case may be. But her registration in her face and in her answers demonstrated that she was not concerned, that my race did not matter to her in this situation. And I understand that people like to think that race shouldn't matter. However, race matters and culture matters, right? And it especially matters when we're talking about a prevalence of issues, a prevalence of healthcare issues that are targeted to one or two particular racial groups. And so I was extremely disappointed in her. You know, I was extremely disappointed in the fact that she is removing uteruses and cervixes and not thinking about, you know, why this is happening and who it's happening to. She's more engaged in the process of the removal as opposed to prevention or education, which was disheartening for me.
Did she talk about the difference in a full hysterectomy and a partial hysterectomy?
Right. So what happened? No, she didn't. So when they told me that I needed to have the surgery, she went straight to a full hysterectomy. So a full hysterectomy, meaning the cervix, the uterus, the fallopian tubes, and the ovaries. And I think that, that we're talking about that a little bit more. However, as a mental health professional, I knew that I did not have to get my ovaries removed. There was nothing wrong with my ovaries, and my ovaries, the hormones that are created from the ovaries also influence the pituitary gland. And from the combination of the hormones from the ovaries and the pituitary gland, that's where we see how people are functioning chemically, right? And so I knew that if she removed my ovaries, it was also going to cause me to go into early menopause. But I knew this. I had done the research. I was aware of what was going to happen. I had family members who had their ovaries removed, and it was too soon. They were in their 20s and their 30s, and they're experiencing early menopause, right? Not fair, not necessary. And so what she said to me was, you know, hey, we have this issue with your uterus, with your fibroids, with your cervix. We're going to go ahead and do a full hysterectomy. And I asked, well, why a full hysterectomy? And she never touched on the ovaries piece. So then I brought up the ovaries piece, and she was like, oh yeah, well, maybe we could keep the ovaries. Well, you know, that's not a maybe. I'm 39 years old, and I should be able to keep my ovaries, right? Like, that's not an issue.
And she should have offered that in the beginning.
She should have offered it in the beginning. In fact, I think we're going to talk about my experience with Dr. D a bit, but with Dr. D, she started at the very minimum. Here's a fibroid. I can remove this fibroid. Or I can remove a couple more fibroids if we see any that are in there. I can remove your uterus if that's what you want to do. I could remove the fallopian tubes. And if you feel that you want to have your ovaries removed, I can remove those. But I don't want to remove those because you are 39 years old, and it's not necessary. And here we can talk about the cervix too. So she went through every single possibility, starting at the lowest level and then going to the highest level of a full hysterectomy. So I ended up with a partial hysterectomy with my uterus removed, along with my fallopian tubes, and then a different surgery to remove the cervix because of the precancerous cells. So she was, I didn't have to ask as many questions because Dr. D introduced the topics to me, very much aware of my race. She brought up my race, you know, and she had an entire conversation with me. I love her so much. I don't know if you want to go there into those questions here, but I absolutely love her.
We'll definitely get there.
Okay, but yeah.
I just want to point out the fact that the comparison that you just painted for us of the previous doctor and Dr. D, that just shows the power of seeking a second opinion, because it's such a big difference and it's so important. It's like you see in your story. Yeah. But I'd just like to just rewind a bit. And so when you went to this first doctor in Annapolis, when did she say that you would be able to have your surgery?
I guess I'm just jumping around because I'm so upset with that experience still. I still am processing it. So this appointment happened in May. And it also included a very horrible experience with the radiology department when it was time, not radiology, with the ultrasound and sonogram department when it was time to do the results. I could talk about that just for a quick moment before I talk about what happened with the time frame. So when I went in for that doctor's appointment, the specialist was doing I always mess it up with the sonogram or the ultrasound, but she was doing that particular exam. And she
for your fibroids?
Yes.
Yeah, that's ultrasound.
An ultrasound, okay. So she saw the fibroid and all the other fibroids. And she was extremely unprofessional in the process. So while she was doing the exam, she was making noises like, oh, ooh, wow. And I was laying there like, okay, so can you tell me what's going on? And she was like, well, it's unethical for me to tell you. You have to hear that from the doctor. And I said, well, you're causing more mental health issues for me and stress for me while you're making these noises, meaning that you see something is wrong, but you can't tell me that something is wrong. And I'm going to have to wait a couple of days to get the results from the doctor. Either you should not make the noises or the doctor should be here with you while you're doing the exam so I don't have to wait long. But then she said that wasn't their process. So anyhow, they got the results, gave them back. I asked for them to be expedited to my doctor. So my doctor got the result. That doctor got the results back within a couple, maybe a day or two. And they called me, and that's when they told me about the results. At that time, they also told me that they would not be able to do the surgery for 4 to 6 months because of COVID, and that the surgical rooms in the hospital were closed down, and that the only people who were able to use those rooms were for pregnancies and for life-threatening emergencies. And logically, I understand that. Logically, I understand that we have to prioritize certain health issues. Emotionally, I did not understand that, right? Emotionally, I'm in pain. At this point, I'm in a pain that's unbearable. I'm having a lot of fear. My family is now worried and concerned. And then I'm told I have to wait 4 to 6 months because you don't have a place for me to have the surgery. So when I eventually found out about the Center for Innovative GYN Care, I was upset again with the first doctor because they knew that surgical centers like the Center for Innovative GYN Care was open and available, but they didn't make that recommendation to me. They didn't make that referral. Instead, they wanted me to wait 4 to 6 months in pain, understanding that it was going to impact my lifestyle and my livelihood just so that they can be the ones to do the surgery. Completely irresponsible, completely inappropriate, and no care or concern at all for who I was as a person. I did not feel seen. I was a member of a factory. I was just one woman coming in for another surgery. They didn't know me. They didn't know LaNail. Instead, they only knew that my uterus had to be removed, right? And they didn't care enough to say, hey, let's get this lady out of pain. Instead, it felt like, hey, here's another woman with a possible hysterectomy, and we can capitalize on that, right? Because of the insurance reimbursements and things like that. So for me, I felt like they treated me like dollar signs as opposed to treating me like a woman, as a person, as a human with a soul and experience and things like that. I get so worked up. I
love it. I think a lot of women can connect to the story, Dr. Plummer.
Yeah, because we're more than just our uterus, right? Like we're more than just the fibroid. We're more than just the cervix. Those are extremely important parts of who we are. But see me, right? And because I'm a Black woman, it was even more sensitive for me. I felt even more that I was not seen. You can't talk to me about the cultural implications. You can't talk to me about what's happening with my community. And you can't see that I'm in pain and this needs to happen sooner than later. Like, who am I to you, right? Like, what do you see when you see me? And I know the answer, right? I'm just dollar signs. I'm just an insurance reimbursement check. I'm just an experimental person that you could try to do this surgery on. At the time, she told me she had only done maybe 2 dozen hysterectomies, and all of them were successful because everybody walked out without a uterus. That is not how I define success when we talk about a hysterectomy, because there's so many other things that are connected internally. And so the fact that she even made that joke was inappropriate to me, like, because I know people who have actually had their surgery done by that office, and they're still suffering. A year later, they're still suffering because it was done poorly, and it was not done with care. And those were Black women who went there too, and it was done poorly. And I can see why, because the doctors just didn't care.
Absolutely. And I'd like to pose a question to the audience, since we're still on this topic. And we want to know how your mental health has been affected through your journey to find relief from your GYN conditions, and if the current health crisis, this current pandemic, has delayed your medical care. So like you were saying, Dr. Plummer, waiting 4 to 6 months for surgery can be so detrimental to the condition that you're experiencing, especially fibroids and endometriosis. It leads to increased problems. It leads to heightened pain. And in the case of fibroids and endometriosis, waiting that period of time leads to your fibroids growing, leads to the progression of the disease for endometriosis. So there's no benefit in waiting to seek treatment. And
it's so interesting that you mentioned the endometriosis, because after the surgery, Dr. D informed me that indeed I had stage 2 endometriosis. But I remember her asking me questions beforehand about pains and symptoms connected to endometriosis. And that wasn't my experience with the first doctor, right? Like they didn't ask any questions related to that. And I understand how difficult endometriosis is to diagnose. However, it would have been appropriate to at least ask the questions. As you mentioned about COVID, the other implication on our mental health is that when we need a second opinion, sometimes it's hard to know where to look for that second opinion, because many of the hospitals are limited right now, and they don't want us to go in unless we already have an appointment, or unless we have all these other precautions in place, which is fine. But when you're in pain and you want relief, that just becomes another obstacle, right? However, that wasn't the case here for me. But yes, and also thinking about mental health and how it affects how our physical health affects our mental health, is that when we're sitting with pain and we're feeling like we don't have resources, we end up feeling very hopeless. And hopelessness is one of those emotional symptoms that connect to depression, right? And if we have depressive episodes and depressive symptoms, that also causes us to become emotionally or even emotionally paralyzed to the degree that we're not doing the things that we used to do, or the things that brought us joy. And so something like hearing, you have to wait 4 to 6 months could have caused me to enter into a depressive episode, right? But again, the doctors were not concerned or caring about that. And so there's a lot of different implications on our mental health when our physical health is being compromised, especially when we're caregivers and we have to take care of other people, or people are dependent on us. It puts additional pressure. And then the cultural piece around Black women many times finding themselves in positions where they feel like they have to take care of somebody, because that's how we've been socialized, right? Like we are the foundation. And so people are always dependent on us. So it was a lot of frustration and concern. And again, it caused me to have my own mental health stress. I talked to my own therapist about it every week leading up into the surgery, because of the emotional discomfort that I was experiencing.
Right. And that waiting period, I'm glad you brought it up. It does take an emotional toll on women. And I'm so glad that you were able to find CIGC. Yes. And to find out that we have been and we continue to be open during this pandemic. And I think I'd like to point out that CIGC is the ambulatory surgery center. So we're freestanding. We stand alone, separate from hospitals. And so given that element, we have been relatively isolated to COVID-19 responses. We don't have the issue of backlog of surgeries that hospitals do. Yeah. And because we are an outpatient facility, there's no overnight hospital stay. You have your surgery and then you go home the same day. And also, as you've seen, Dr. Plummer, that at CIGC, we've implemented increased COVID-19 screening practices to really ensure the health and safety of everyone at our center. Clinicians, patients, we make sure that our patients are screened or tested based on their current state's regulations prior to having surgery. and all clinical staff are screened regularly.
Yeah.
So with that being said, let's talk about your experience with CIGC. How did you hear about us? I know you're going to repeat a few things, but I want to hear it again.
It's my love story. I love this place now. And I'm like telling everybody about it. Like, oh, that's your issue? You got to go see Dr. D. So I had that experience with the first doctor in Annapolis, and I was speaking to a couple of my friends one evening and telling them what's going on. I also like to mention that as open as I am, and clearly I am very open because I'm doing a Facebook Live about this, right? But as open as I am, I was still feeling extremely vulnerable about the fact that I was going to have this hysterectomy. Even though I had decades to prepare for the fact that this would be my response, my experience, a still very vulnerable moment. So I said to which then means which then also shows that Black women are not always talking about our physical health issues, right? Like we want to push on and we want to be strong and we want to just, make people think that everything is okay, which is clearly a mental health challenge also. And so with that particular night, I said, you know what, let me go ahead and try to talk to my friends about it, just so that if they're having any health issues, that they can also go and use my experience to go get checked out. So I was on a video call with my friends, shout out to my sister circle. And one of my friends said, hey, you should, if you're looking for that second opinion, you need to check out Dr. D at the Center for Innovative GYN Care. And I said, okay, that's great. I know that she had a wonderful experience with Dr. D herself. And so I said, okay, that's great. That's wonderful. I'll check them out tomorrow. So that next day was that Saturday, and I went on the website and everything looked great. And so I called that Monday. And from the moment that I called, I experienced peace. From the very moment when the young lady answered the phone, the receptionist, one of the first things she did was acknowledge my pain. Like, I am sorry that this is happening to you. I understand how challenging it may be. I understand how difficult this is. We will do our very best to make sure that we can help you to not experience this pain anymore. And we will do our very best to make it a seamless process for you. And she immediately scheduled me for an appointment with Dr. D. I think I called maybe that Monday, and I had an appointment with Dr. D that Friday. And so that was a surprise because we are in the middle of COVID. So I thought they were going to tell me to do a video meeting, which again was going to be complicated because we can't always see the protrudingness of the uterus in the video. And so I was concerned that if I did another video, it was going to prolong the process. But instead, they told me to come in. And of course, like you mentioned, they did the COVID screening and et cetera. And although they needed to keep the waiting room kind of clear so that it's not making things complicated around COVID, they did tell me that I could bring somebody and have them waiting for me. So again, that stark difference between, we're going to examine you and give you this information, but we do want you to have somebody with you nearby. So please consider bringing somebody with you. And then I went in. The process was super easy. They had the records that they needed. They were extremely engaging from the very moment I walked into the office. Everybody, good morning. How are you doing? What's your name? Oh, we've been waiting for you. We knew you were coming. And I wasn't late, I promise. But their process of saying, like, we knew you were coming and we were excited to see you. And even going back to the exam room, Dr. D didn't even have me waiting a long time. Sometimes we have these experiences with our doctors where we go back to the exam room and we're back there for 15 minutes, 30 minutes, whatever. That's scary when you already know that something is happening. Like, waiting that long time just causes more anxiety. So she came in immediately, maybe 5 minutes after they took all my blood or took all my the preliminary information. She came in and she started talking to me, and she spoke to me like a person. She spoke to me like I was a human. Like, tell me your experiences. Tell me when you knew about this pain. Tell me what you know about, hysterectomies and partial hysterectomies. Tell me what you've been thinking about over the last couple of weeks. And it was one of the first times in my 39 years, almost 40 in 2 weeks, my 40 years, where a doctor did not rush to get information. it did not feel like a checklist. It felt like a conversation.
Mm.
And I'm getting emotional. I didn't think I was going to get emotional, but I'm getting emotional while I'm thinking about it, because she then told me that she could help. And she was like, okay, I can help you. And although the other doctor probably could have helped me too, she never said it, right? She never said like, I'm here to help you. But Dr. D was like, I can help you. I'm going to help you. And we're going to do this get this, we're going to do it in 3 weeks. And the only reason it's going to take 3 weeks is because it's right before the 4th of July holiday, right? Because otherwise she would have been able to do it faster. So one doctor is telling me 4 to 6 months, and another doctor is telling me 3 weeks. I almost cried in that room, because I knew that in 3 weeks I wasn't going to have the same pain. I wasn't going to have the same discomfort. I wasn't going to have the same worries and anxieties, etc. So she explained the process to me, that this surgery could be done laparoscopically, which was mind blowing. Here I am with this, with this experience, with this advanced degree, and never even knew that a partial hysterectomy could be done laparoscopically. So of course I was in shock, like, oh my gosh, this is amazing. And then she told me, we're going to do it as an outpatient procedure, so you can go home that same day. What? I can heal in my house with my family around? Like, I was amazed by all of this. Still in shock with how 23 centimeters of mass could be removed laparoscopically, but she explained it to me in very much detail. So where I had the one doctor who didn't answer my questions, I had Dr. D who answered every single question. And because I had 2 hysterectomies, I was concerned about the incision in that area again. And she explained to me how she was going to do it and how it was going to heal up and what the next steps were. And everything was so calm and reassuring and nurturing and loving. And I use the word loving for a doctor, which is, again, not a common experience for me as a Black woman. But she was wonderful. She was great. And I left that office and was excited about the fact that I finally found somebody who was going to take care of me and take care of that womb. And I think I mentioned it earlier about what it means for me to have my uterus removed, the womb, the place that carried both of my children, and to have that taken from my body. And she was going to take care of me and that with care. So then quickly, so we scheduled the appointment, and her support staff called me and emailed me and made sure, like, up until the surgery, I was in contact with them maybe at least once a week, where they were getting me mentally and physically prepared for the surgery, making sure that I had everything. They had no issues. The medication was at the pharmacy, no issues. They explained how the insurance was going to work, no issues. They explained what my co-payments were going to be, no issues. Who was going to be in the room with me recovering, no issues. Like, everything was laid out, perfect, calm, wonderful. So then we went in and had the surgery. It was a wonderful, seamless process. I think it's also important for me to mention that Dr. D gave me all my options, and then right before the surgery, before the anesthesiologist came in, so I was very sober, she asked me again about confirmation for each and every surgery that she was going to do, every single removal. Okay, we're going to remove this. Are you comfortable with that? Are you 100% sure you don't want any more children? Okay, let's move forward with that. It's time to talk about your cervix again and the precancerous cells. Do you want to go ahead and move forward with that? So although I had already confirmed everything for her, she allowed for a space for me to change my mind up until the moment that they were about to will me back. And she did that in a way that I was very conscious. After she left, and she answered all my wife's questions. So my wife was in the room with me as I was about to prepare for surgery. And my wife asked maybe 10 questions. And Dr. D answered all those questions as if my wife was her patient, right? Like, she was calm and eased with it. Then they gave me my medication, took me back, had the surgery. I came back out into the recovery area with a recovery staff that was loving as well, right? Like, I know I was a pill that day, but it was a wonderful process. fast forward, so they took care of me 100%, called me after every few days after the surgery to see how I was doing. And then I went in for my follow-up appointment, and it was the same as my first appointment, where Dr. D answered all my questions. And at this point, my questions were not just related to me and my healing, but also the implications for my daughter, who's 16. And she answered all of those as if my daughter was her patient. And she answered my wife's questions again about her own physical health as if she was her patient. Like Dr. D just made us feel so comfortable, and she cared about us as a family, not just me and the uterus that she removed or the cervix that she removed, but she cared about the implications for the future as well. And I love her. I love her. And see, I could talk about her all day. I'm running.
So how many fibroids did she remove?
20 fibroids. They thought it was one. She thought it was one. She knew there was a possibility that there could be more that was hiding behind that one. But she removed 20 fibroids, including the uterus, including the fallopian tubes, including the cervix, and told me that I had stage 2 endometriosis.
You know, I really appreciate the fact that you were proactive as a woman, as a patient, to look out for your daughter, to look out for the next woman that may be experiencing that. So, that's really powerful. And so I wanna just touch on the fact that many women don't even know that there are different types of laparoscopic surgeries. Like you were saying, you were expecting to have a C-section cut just like you did with your children.
Oh, well, and also because that's what the first doctor told me. 4 to 6 weeks 4 to 6 months is what my wait time was going to be. But they told me that I was going to have it done like a C-section, and the recovery time was going to be 6 to 8 weeks, similar to a C-section. So this is what they had told me. And then to turn around and find out that it could be done in 3 weeks with a short recovery time. And I'm recovered. At this point, I'm pretty recovered. I'm back to riding my bike 11 miles a day and preparing for my runs. And the surgery was only maybe 6 weeks ago. So yeah, that's what they told me. And it didn't have to be that way. And that's what was frustrating, that they didn't care enough to tell me that there were other options.
Right. And a lot of women don't even, if you didn't seek a second opinion and if you just settled for that, let's just say that your first experience with that doctor went well. Like, she was very pleasant, but she said, this is your option. You're going to have open surgery. Maybe you would have gone with that. Maybe you wouldn't have. But a lot of women do go with that because of the trust that they have with that OBGYN. Yeah. And I just want to point to the research that we've done at CIGC. Yeah. But before I do, I want to pose a question for the audience. For those of you who have felt the need to ask another medical professional about your condition, what led you to seek that second opinion? And if you didn't seek that second opinion, why not? So in 2017, we conducted a qualitative study through survey data to focus, to further explore this issue. We wanted to know why over 45% of women are still having hysterectomies, especially really invasive options that are available to us. So we sought to explore the factors that influence the patient decision-making process when choosing the route of hysterectomy. We had over 450 responses in the survey. 38% of them had an open hysterectomy. 62% of them had laparoscopic, minimally invasive hysterectomies. So from the pile of respondents that had open hysterectomies, 63% of them indicated that the type of hysterectomy didn't matter to them, or they didn't know about any other surgical options. 63% is a huge amount compared to 28% of the laparoscopic group. And we tend to find that women who go for the minimally invasive options, at that point when they decided, okay, I'm going to go for this minimally invasive laparoscopic option, they've done their research, right? And we found that 47% of the open respondents indicated that they weren't given alternatives to open hysterectomy, just like we were talking about. And 80% of both groups didn't feel like they didn't need to seek a second opinion, mainly because they trusted their OBGYN. Yeah. So, and another shocking thing was that 90% of respondents in both groups indicated that they were satisfied with the surgeon's explanation of the surgery. So you go in for your consult, the surgeon explains the surgery, you give your consent, you have your surgery, yet 60% of the laparoscopic group and 25% of the open group didn't correctly identify the type of hysterectomy they underwent. This is quite shocking for if you're undergoing open hysterectomy and you don't know that you had just had a big C-section cut for your surgery. That's pretty shocking. And I think that just speaks to the gap in the education that takes place in the consultation room. A lot of the responsibility is put on the OBGYN, and it needs to be put, because in order to deliver the highest quality of care, it's so imperative for OBGYN surgeons to offer patients all treatment options, and that includes referral to GYN specialists. So if you're not skilled to do laparoscopic, minimally invasive surgery, refer your patient to your colleague that is trained, And the way I see it is, put your ego aside, you're working together in this, right? And when you take that Hippocratic oath to do no harm, that's what it is. You refer your patient to someone that can give them the best option for that patient, not for you as a practitioner.
Yes.
So let's talk about your recovery, Dr. Plummer. How was that?
Yes, absolutely. And I just looked for a second at some of the comments too, and I feel so connected to all of you all that are on the comments and these experiences that we're having. And also very excited because the client that encouraged me to get my exam done is actually on the chat too. So I appreciate her for supporting me as well. So the recovery, because the surgery was done laparoscopically, they filled me up with gas to do the surgery, right? That was probably the most uncomfortable part of the recovery. Believe me, right? Like that was just it. So I thought it would be the incisions that were extremely uncomfortable. I thought it was going to be the whole healing time that was uncomfortable. No, it was probably just the gas. Dr. D was so skilled in her process that I didn't feel a lot of pain afterwards. And so with the recovery, I had the surgery on a Thursday. And I was probably feeling a lot better maybe by that Sunday. But the Dr. D encouraged me to walk. So before I could even leave the surgical center, I had to walk around so that they could see that I could walk and that everything was functioning the way that it needed to function. I came home. I was in a lot of pain, mostly because of the gas and probably, and of course, the surgery too. But my family took a lot of good care of me. Within about a week, by that next Thursday, I was no longer taking the intense medication, right? So the oxycodone. I had spoken to Dr. D about the fact that my family also has a history of addiction, and so I was very apprehensive about taking pain medication. So we spoke about that, and she advised me on how she wanted me to take care of myself when I got home so that I didn't put myself in a position to potentially become addicted, right? Because we know that people get addicted to some of these pain medications. So again, because she asked me a lot of questions about my family history, she was able to even tailor my post-surgery treatment based off of some of my own cares and concerns. And again, so very wonderful experience. And about 3 weeks after the surgery, I went in for the follow-up appointment. And by that time, I was walking back around in my neighborhood. I couldn't walk as fast, but I was walking in my neighborhood again. I was able to take care of myself and do the things that was important to me because that's part of my lifestyle. And so when we had the follow-up appointment and she spoke about my recovery, that's when she removed all of the tape and all that good stuff. But by that point, everything was healed. So I was surprised to see that my body, especially on the outside, was 100% healed and closed up, which was not what I was expecting. But because it was done laparoscopically, I can't even see the incisions now from where they were. So the recovery process has been wonderful. It's been great. I'm now about 6 weeks out of surgery, 7 weeks out of surgery. And I'm able to do everything that I once did before. I'm riding my bike again. I'm walking again. I'm preparing for a race that I'm doing for my birthday. I'm able to take care of myself. There's moments where my energy is was a little low, but I'm back to normal and I feel great. And to think that I would have had to wait so much time for healing was ridiculous. The actual healing for the hysterectomy was a lot quicker and easier, but the process of removing the cervix is what took a little bit longer in the healing time. But I didn't feel a lot of discomfort, right? Like even some of my good friends are on the chat right now and mentioning that I didn't have a lot of post-recovery or a lot of post-surgery pain. I was slow because I did have a surgery, but I was not being forced to be in my bed or anything like that. In fact, the doctor's assistants were calling throughout the recovery weeks to check in on me and to give me other tips around how to ensure that I was recovering properly and with good care. So they have taken care of me 100%. Even I had a call from the doctor's office a couple of days ago, again, a check-in call. And I was like, hey guys, we're like weeks out of the surgery. They're still calling and checking in. Hey, LaNail, how are you doing? How are you healing? This is what, we're thinking, etc. And I'm still amazed, like they're still taking care of me. Like they have already done everything that they're supposed to do and still calling in to check in to make sure that I'm okay. So the recovery was wonderful. Like I mentioned, I had C-sections before, so I knew what that recovery was like. And I was expecting that type of pain and discomfort, and it was nothing like that at all. It was very, very much of ease. Discomfort, yes, because it's a full surgery, right. But pain and all of that, not as much, right? So I'm excited, and I'm telling everybody, I hate that we have to still, as women, go through this particular type of surgery. I hate it, and I want us to do more research around it. But if people do have to have a hysterectomy or a partial hysterectomy or a myomectomy or whatever the case may be, they have to go to the Center for Innovative GYN Care, because that's where they take care of us. That's where we're taken care of.
I love that. Thank you for sharing that. So I remember speaking to you before. You talked about how the entire time you guys were obviously, you ladies were wearing masks when you were interacting with each other. Could you just tell us that little story?
Yes. So of course we're in the middle of COVID. So when I go in to see Dr. D, I have on my mask. She has on her mask. All her staff have on their mask. It's time to do the surgery, and the entire team have on their mask, and everybody is so nice. But you have to pay attention to people's eyes to see if they're smiling, because you can't actually see their mouth and everything. And so one day post surgery, while in recovery, I was like, I should probably see what Dr. D looks like because I don't know what this woman looks like. I only know her eyes. So
you went into a blind marriage.
I went into a blind marriage. So I went onto the website and I saw her and I was like, oh, that's what Dr. D looks like. And she's absolutely beautiful. So I was like, oh, that's awesome. But it was just so funny that she did my surgery and I didn't even know what her face looked like. Clearly she knew what my face looked like at some point, right? But I didn't know hers. And I was like, oh, that's Dr. D. if I hadn't gone on the website, I would have seen her out on the street and wouldn't have even known she was the doctor who did my surgery.
And I think that really speaks to the fact, because before you were saying you were giving your love speech for Dr. D, and you didn't even see her. Like you didn't even see her face, and that just speaks to her ability to bring in that human connection.
She felt me, and she saw my soul, and in return, I felt her, right? And I didn't see her face, but I saw her care and her concern for me. She asked me about my children, right? Like she wanted to know how this surgery and how the recovery time was going to affect my children, because they were scared. They're 16 and 13 and their mom is having a surgery. She asked those kind of questions, like who's going to take care of you post-surgery? Who's going to help you take a shower, right? Who's going to be the one to make sure you have the food that you need to eat? Who do we need to talk to? And also, let me mention real quick, while I was in surgery, her and right after surgery, her and her team were constantly checking in on my wife. This is what we have done. This is the procedure that we have done. This is what we have removed. This is where she is in recovery right now. This is where we anticipate she'll be in an hour. This is where we think she'll be in a couple hours, right? They checked in on my wife to the degree that she felt comfortable. And it was nerve-wracking for her. I'm having surgery, but they kept making sure that she was taken care of also. That in itself speaks volumes. It wasn't like she was just out in the waiting room by herself. No, people were taking care of her too while they were taking care of me.
It was like building a community within clinical practice.
Absolutely. That's absolutely what it was. Yeah. Absolutely.
And speaking of community, so could you talk a little bit about the prevalence of GYN conditions in your own personal community?
Yeah, in my neighborhood, in fact, right? So in my neighborhood, there's 10 families right around here who have had who've been affected by women's health issues. 5 of us within the last year have had hysterectomies. I've had neighbors on my block who've also had hysterectomies in just this last year, from last September to now. Most of them went to another center, or the center in Annapolis. One of my neighbors had a fibroid, and I was talking about them. We have a cool neighborhood group chat, right, for everybody, but then also one for the ladies. And I was telling them, like, hey guys, listen, I'm going to be a patient advocate for Dr. D's office. Join me for the Facebook Live. And one of my neighbors was like, Dr. D did my myomectomy. She removed my fibroids. And another one was like, Dr. D did another one of my surgeries. And all of a sudden we have this whole Dr. D fanfare over here. We're like her biggest fans right here in our neighborhood. But yeah, so it's so prevalent that just on my block alone, we've had 5 women in the last year to have fibroids, 10 families affected overall. And that's just my neighborhood. You know, I've already spoken about my family, where it was my mother and my grandmother, my aunts and my cousins. And it's really hard when a woman has to hear that they can't possibly have children because something like fibroids. And sometimes we don't know that it's happening, and sometimes we're prolonging it because of our fears, or sometimes it's just because we don't know who's going to take care of us. And so that's why I wanted to do this with you guys today, because I wanted more women overall, but especially Black women, to know that there's a place that's going to take care of us, guys. They're going to take care of us.
Yes, absolutely. And we do have enough locations to provide that access to women across the country. We have a surgery center here in Rockville, Maryland. We have another one in Montclair, New Jersey. We have clinics in West and New York City. So definitely we want to make sure we provide that access to women. And I am trying to now look to see if we have any audience questions, but I don't see we have any yet. So before we close, Dr. Plummer, in closing, I want you to give all women just one piece of advice that you walked away with your experience. Well, what advice would you give?
The piece of advice is, when you feel the pain, go ahead and get it checked out, right? Like, life is happening, things are moving. We have families that we're taking care of, work that we have requirements for, but none of that can function if we're not here. And we can't do good to our family. We can't do good in our communities or with our work if we're not taking care of ourselves. And so although it's scary, and we don't know who's going to take care of us, it's time to get taken care of, right? Like, it's time to make our bodies a priority, because we need ourselves, and then our families need us, and then our communities need us, and then our work needs us. So that's my piece of advice about healthcare. My piece of advice about second opinions is always go for a second opinion, right? Like, it's just worth a try. Your insurance company is going to cover the second opinion. You don't have to worry about it. Your friends and family might have had experiences, and those experiences worked for them, but you have to consider what is going to work for you. So always consider a second opinion. And the third thing is, understand that there has been so much innovation in the healthcare industry that the old way that surgeries were done are not necessarily the way that surgeries are done now. So the way that your mother and grandmother recovered is not necessarily going to have to be the way that you recovered, because there's far more options out here now. And then the fourth thing, I love Dr. D. Go see Dr. D.
I love it. Thank you so much, Dr. Plummer, for joining us. We'll have a recap of this event published on our blog next week. Both a written article and a recording will be available at innovativegyn.com/LaNail. And before we close off, I wanted to share 2 exciting things that we're doing at CIGC that I think is also relevant to this whole discussion, Dr. Plummer, in the mental health aspect in GYN care. So starting September 1st, CIGC will be opening a wellness center. And yes, I'm so excited. The CIGC Wellness Center was designed with women like you in mind, where with endometriosis, fibroids, and chronic pelvic pain, whether you're preparing for GYN surgery or looking for a non-surgical approach to manage your symptoms, you'll find that this wellness center offers therapies targeted towards your health goals. And at the Wellness Center, we'll be offering pain management, acupuncture, pelvic floor physical therapy, physical training. We have our own gym, nutritional counseling, and psychotherapy to help treat and manage all GYN symptoms. And there's still so much to learn about gynecological conditions and how they affect women. And for those in the audience, we also want to hear about your health journey. So we're collecting responses through our women's health survey so we can improve our research efforts in this critical area. Please visit innovativegyn.com again /LaNail to take the survey, which will be linked at the bottom of the page. Thank you, everyone, for joining us. Thank you, Dr. Plummer, so much for joining us.
Thank you, thank you, thank you, thank you.
Have a good one.
You too.
Bye.
Bye.